Response to intervention. Morgan Morris, ED 311-316 for Dr. Stanford. What is response to intervention? It's also abbreviated as RTI. RTI is an approach that came from the Individuals with Disabilities Education Improvement Act, IDEIA, which was approved on December 3, 2004 by President George W. Bush. RTI is a way to provide early intervention to help identify students with specific learning disabilities, also abbreviated LD. It is necessary to use research-based interventions in this model, which also relates to No Child Left Behind, NCLB, in that it is comparable to the Reading First component of NCLB. Reading First requires schools to use scientific knowledge when selecting the curriculum, and schools must also use progress monitoring with their students so they can decide who needs more rigorous instruction. RTI helps to take an earlier look at intervening at an earlier stage for students who are not meeting benchmarks within their educational setting. It is important to reach students who may be at risk for failing in school before they actually reach a failing point. RTI is also replacing the IQ and achievement discrepancy model. When this model was in place, students were given an IQ test and also achievement tests. If there was a severe or substantial discrepancy between these, the IQ test and achievement tests, a student would then be diagnosed with a learning disability. This also meant that the student will have had recurring failures within the school setting and had a large deficit in the academic area, such as reading, writing, or mathematics. But this wouldn't give the teachers a reason that the child is failing or falling behind. So in this RTI model, a student will be given one or more research-based interventions and be monitored to see if they can again reach their benchmark level, or something else may need to be altered. RTI is a multi-tiered approach. The first tier is often referred to as universal intervention or benchmark level. This is where about 80 to 90% of all students are, meaning they are in the general education setting. The second tier is called individual intervention, targeted level, or strategic level. This involves individual or small group interventions and is where about 5 to 10% of the student population falls. The third tier is the intensive intervention level. This is where about 1 to 5% of students will often be referred to for LD eligibility. During the first tier, a student should be regularly meeting benchmark levels. One example is for reading fluency. Dynamic Indicators of Basic Early Literacy Skills, DIBELS, is an assessment program that can help to test if a student is reaching their fluency benchmark levels. If they seem to be unable to meet these requirements, which will help to keep them more successful later in their schooling, they will be referred to Tier 2. In Tier 2, students will be introduced to research-based interventions. This may be in an individual setting or group setting, depending on the needs of the student. He or she may not have had the reading skill set or may just need to work on fluency or flow of their skills. So in this case, these will be the skills that would be addressed within the interventions. Progress monitoring will be taken during this process as well to determine if the student is moving towards reaching the benchmark or falling further behind. The third tier is reached if a student is continuing to fall further behind. He or she may need further assistance and may also be referred to a special education setting. This also may mean that a student might have the need for an aid. Assessing and reassessing will continue throughout all three tiers, and a student may move within them multiple times. RTI is often used for academic problems, but it can be used for behavior problems as well, especially since these can often be tied together. RTI involves an array of individuals to make it work. A pre-referral team is used to help a general education teacher come up with strategies to help at-risk students within the general education setting. This team consists of many of the same people who assist with the RTI model. Some of these include teachers, both general education and special education, literacy coaches, peers, Title I teachers, teacher consultants, counselors, psychologists, and administrators. These actions should also be relayed to the parents. Programs and assessments that are used include research-based interventions, as I referenced before, curriculum-based monitoring or measurement, also called CBM, progress monitoring, and behavior charts. CBM involves evaluating the performance of students based on the curriculum that students are using and being exposed to. Progress monitoring is one of these CBMs. It is done on a regular basis and tracks the student's progress. In this chart, a student would be tracked for their fluency levels on a weekly basis. A behavior chart can also be used. It is often used to monitor the student's behaviors during an intervention session. The chart asks questions like, was the student on time and prepared for class? And did the student follow your instructions? A good way to address this would be to follow up with the student and ask their opinion. This gives them responsibility and ownership of the process. Marquette, especially Sandy Knoll, has been putting RTI into good use, especially when it comes to the reading portion. When I spoke with Mrs. Huss, the special education teacher at Sandy Knoll, she told me that in order for RTI to work properly, the school must have the support of the staff and administration in order to make it work. Reading is the area in which Sandy Knoll has been rather proficient. Mathematics is another area where they are trying hard, but writing is an area that they are still trying to work on. At Sandy Knoll, the intervention cycles fall about every 3 weeks. Progress monitoring is done using the other two charts I showed previously, and this one as well. These are all kept on file within the school and are what are used to create the referrals used within the RTI process. RTI is still a work in progress. It will need to continue to be assessed for the advances that are being made with it and improvements that may need to come as well. Teachers must be flexible, patient, creative, and continue to have a good relationship with their fellow educators in order to make this the program that it can and should be.